I saw you on C-SPAN the other night. You look so tired. How many hours in your office has been dedicated just to this healthcare bill?
I can't quantify the number of hours that we've been investing in this issue, but it's been worth every minute of it, hundreds of hours.
Unemployment rates for the state of North Carolina at an all-time high. Is this going to help? How is this going to help the community with the healthcare initiative, other than just affordable healthcare for people that are unemployed?
Well, one piece of healthcare reform is information technology. That's an issue that we've been really concerned with. We've invested several $billions in improving the technology infrastructure for healthcare. That's going to create a lot of jobs. It's going to create jobs here in Eastern North Carolina. We're going to double the number of community health centers in Eastern North Carolina. Those health centers are going to require staff. There are things in the bill that will translate into jobs.
Getting rural health clinics in Eastern North Carolina is important because socioeconomically depressed people don't have as much transportation as I guess regular folks do. How many healthcare centers do you think this could help in Eastern North Carolina, and especially in your district, too? It's one of the poorest districts in the country.
Yes. We're going to increase the number of health centers in the 1st Congressional District and also increase the capacity of the existing health centers. That will enable them to reach thousands of patients that otherwise would not get treated.
So, in other words, then, we're not going to have the burden, hopefully, in the next few years of emergency room visits. Emergency rooms are going to be used for what they were originally intended to, which were emergencies.
The purpose for improving community health centers is to take the burden off of emergency rooms. First of all, hospitals can't absorb the uncompensated cost of emergency room visits. And so we've got to transfer those patients to community health centers who can do what needs to be done. But let me tell you, George, at the end of the next decade, we're going to look back on this debate and come to the conclusion that America's better, families are better, the government is better, businesses are better. We're all going to benefit from improved healthcare delivery in this country, and it's completely paid for. Our critics are saying that it's going to add to the deficit and debt. That is not true. We're going to make Medicare more efficient without cutting services. We're going to place a tax on millionaires who have high-end Cadillac plans for their insurance policies. They're the ones that are going to pay the cost of this. It's not middle-class families, and certainly not low-income families.
Let's talk about the cost of doing business. You know, this is taking a toll on you. It's taking a toll on your office. There have been at least 10 members of Congress that have had death threats. We've seen it on MSNBC. We've seen it on a lot of other stations. How concerned are you in your district about safety?
Every member of Congress is concerned about his or her safety, and I'm certainly in that number. And I appreciate the Rocky Mountain Police Department today for having some degree of security at this event. I hope this is something that we won't have to do on a sustained basis, but I'm paying attention to my environment.
Have you had any threats?
No, I have not had any threats. The office has had some very discourteous callers and a couple of visits from people who have been discourteous. But to say that it was a threat, I cannot actually say that.
You think the Tea Party movement has anything to do? You know, we had one in Rocky Mountain not too long ago. You think that the Tea Party movement has anything to do with this, or?
It seems to me that the Tea Party, as we know it, is a group of individuals that are uninformed. They really don't understand what healthcare really is. And I think they're getting most of their news from Fox News and from the right wing. And from what I can gather, those in the Tea Party are very intelligent, decent Americans who believe a set of facts that don't exist. And so I would really encourage those individuals who consider themselves part of the Tea Party to understand that America is going to be stronger, America is going to be better, small businesses are going to be stronger and better, families are going to be better. We will all benefit from health care reform, and it's not going to add to the debt or the deficit. Some of them find that to be laughable, but the truth of the matter is that we have a plan that's going to improve America.
Well, let me just ask you on a personal note, and I know that President Obama is one of your good, close personal friends. How do you feel personally seeing him portray in your district with some Tea Party members with a swastika, a Heil Hitler salute and the mustache.
It is disgusting to see anyone portray an American president in that light, whether it's a Democratic president or a Republican president. It is despicable. And I would hope that we can tone down the rhetoric, take this debate to a level of intelligence and not to a level that will demoralize and degrade the presidency.
All right.
Yeah.
Thank you,
Okay.
Congressman.
All right.